Great, thank you so much. Welcome everybody to the PM committee meeting for today, November the 17th, 2021. It looks like we have quorum, obviously. Actually, we've got perfect attendance. Very good, everybody. Look for any disclosures of pecuniary interest if you have any. I've received none and I see none. So that is great. Thank you. We will move on to item 3 of the agenda, which is from the Board of Health. We have a medical officer of health update regarding COVID-19 as per usual. I will look to Dr. Ranaday to see if he is, but there you are. Take it away, sir.
Thank you. Can you hear me? You can?
Yes,
okay,
can.
Great. I don't have a very long update today. Most of what I needed to tell you we covered at the last time council met. So in terms of cases, we are reporting that we had 3 cases yesterday, and prior to that we had 12 cases. So you can see there's still a lot of variability in what we're getting. A handful of cases any given day. They take a long time to follow up on, as we've spoken of before, just because of the number of contacts that people have. We have about 4 outbreaks currently, and they're reasonable in size. They seem to be relatively well controlled at this moment. And in general, unfortunately, we have had a couple of deaths in one of those outbreaks at an institution. And I think, if I recall correctly, that those 2 deaths were in people who were in a high-risk age category, recognizing that so it's important to recognize that's still happening, but at a lower rate than we would have expected if there were a largely unvaccinated population, right? The context in which all of this is happening, I mean, our cases are moderate and either stable or decreasing, but Ontario's cases are increasing. And so I think just the other day they reported over 600 cases with slight increases in deaths, which are a lagging indicator, right? And it's also happening in the context of significant surges in European countries, which I would say are probably a few months ahead of us in terms of where the pandemic status. And so the things that are happening there, we expect to happen here, a few months later. So it's important for that context to see that, that we're seeing large surges in these different countries. They have variable vaccination rates. The surges are largely in unvaccinated populations, but they do affect vaccinated populations as well, just at a lower likelihood or lower probability than people who are unvaccinated. And that's what we're seeing here as well. Our 2-dose coverage of the eligible population is just over 81%, and it creeps up all the time. But again, the demand has slowed to a trickle for that. And that's going to have implications, the remaining unvaccinated population, in terms of what happens as we move through the winter months. We're also offering, we're seeing a larger demand now for 3rd doses that are being offered to eligible populations, right? So that's people over 70, people who work in specific professions who are identified in the earlier stages of the vaccine rollout, First Nations, Inuit, and Métis, people from those communities, as well as people who received non-mRNA vaccines their first time. Those are people who are eligible, and you need to be about 6 months out from your 2nd dose in order to get a 3rd dose if you're eligible. But we are seeing increases in bookings for those groups of people. And also actively preparing for announcements related to immunization in the 5 to 11-year-old population, which will be a different formulation, the same vaccine, but just a different concentration. And so when we receive that and when it's approved by Health Canada, we're preparing to deliver that as well. I don't think I have anything else, because most of the things that I needed to cover with you, we covered in the last go-round at the last council meeting. So I think I'll leave it there.
Great, thank you so much for that. Look to the committee for questions if you have any. Councillor Stark.
Yes, thank you, Dr. Ranaday. With respect to the age of 5 to 11, and with reference to your 81% being fully vaccinated, If we were to achieve 100% of the 5 to 11 being inoculated, what would that represent as an increase in the 81%? Would we get to 85%, or what number would that be?
You know, I'm not entirely sure, because what would happen is once the 5 to 11 age group becomes eligible, our numbers will artificially drop because a larger population is now eligible. And so it's almost like it would go down to 70 something and we'd be climbing back up to 80 as we get those folks immunized, right? So it's challenging to say. I think that it's probably more appropriate to look at it in terms of the numbers that we expect. And we think there are about 9,000 to 10,000 people who fall into that age category. And we expect, based on a survey that we've done recently of parents, for about, for the demand to be about 60% of those children. The parents will probably bring them in as soon as possible to bring them in to be immunized. And then we'll have work on the remaining 40%. So that might be a better way to look at this rather than the overall eligible population, because I'm not sure where that would end up.
Thank you. That answers the question. Your comment about the number going down before it goes back up really is the relevant point. Thank you.
Thank you. Councillor Cook, please.
Thank you, and good morning, Dr. Renaday. Question about vaccines now. If with the declining cases of people being inoculated for second shots, is there a case that we're going to run out of, I guess, current vaccines, or we're going to have an excess amount of current vaccines that could be expiring? Is there going to be a ramp up to get more boosters into people to offset those shots?
So I'm not sure how to answer your question, but I would say that the same doses that could be expiring could also be used as third doses. And so I would say that the timing fits in a way, or it's beneficial, because we can use doses that are approved for that population as either first, second, or third doses. And so it does help us move through the vaccine that we have, but we also have vaccine that has, reasonable expiry dates that are well into the new year. So we've got, especially once it's frozen, you get a lot more time with it than if it's just in the fridge.
Thank you.
Councillor Arnold.
Thank you, Chair. Dr. Renaday, I see, and I know it doesn't apply necessarily to us here, but in Detroit, they're talking about having the Pfizer vaccine in pharmacies. And how can they do that when it has to be kept at such a low temperature?
So some pharmacies do have the ultra low storage requirements that enable them to carry vaccines like Pfizer. But also for both Pfizer and Moderna, I believe there have been some additional stability tests done at refrigeration temperatures. And so you can store them for shorter periods of time in refrigerated environments. So they have to be there's a total amount of time that it's allowed to spend in a refrigerated temperature. And so pharmacies that might be able to do a high volume would be able to store it at that temperature because they would use it quickly once they receive it.
Great, thank you. Any other questions from members of the committee? I just have one, Dr. Renaday. You indicated that the case count in the rest of Ontario is starting to creep up, and I think our trajectory has always been lagging the rest of the province. So is that an expectation here that our case count will start to creep up in the near future? And if so, is there anything different that we can do?
So to your first question, I would say yes. I mean, I expect that, two things. I expect that, yes, our case counts would be lower now, and then after the province rises that we would rise again, just because that's been our pattern. But I think a couple of pieces around that in terms of what can we do. One of the things we have to start doing, I think, is expecting it. Just recognizing that this is going to go up and down, and it's going to be with us for a while. And so we need to sort of not necessarily in public health, we monitor all of these things and we worry about them, but not necessarily get too worked up about the ups and downs of this over time, because we're going to just keep seeing that, right? I think the other thing too is to say, how effectively have we decoupled cases from hospitalization? Right? Cases from severity. And I think there's a strong indication that vaccines have helped to decouple. It's not perfect. It's not 100%, but it's very, very strong. And so I think what we're going to do is we're going to start seeing lots of times where we have cases potentially largely in unvaccinated or under-vaccinated populations, with maybe some spread to vaccinated populations. But I think the more critical thing is, are we getting lots of people who are really sick as opposed to worrying about just the numbers of cases? And I think what we're seeing is, even when we've had cases, for example, in long-term care homes, yes, there are frail people there. Yes, there are people who might, even with 3 doses, still be more vulnerable to severe consequences, but the rate of those consequences is much lower than we would expect otherwise, right? So we're going to have to start building a little bit of community risk tolerance for having cases, knowing that a lot of people are vaccinated.
Well, you bring up an interesting point there, because I think a lot of people have been asking for that decoupling for many months. So is it fair to say that we're at that point where it from a medical perspective makes sense to start decoupling the cases from the hospitalizations? And if so, are we going to focus more publicly on the hospitalizations as opposed to the case counts?
Good question. I mean, I think that it's going to take a while for everybody to get there. And we're still nowhere near there in some sense, because we're still offering 3rd doses to people who are fairly vulnerable, right? So I think what you're going to see over the next several months is this sort of reorganizing of how we think about COVID, and it's going to manifest itself in a few different ways. It's going to manifest itself in changes in the guidance around how we manage outbreaks. It's going to manifest itself in, and then the very last thing it will manifest itself in is changes to the way we communicate information about COVID, because I don't think we would get to the place where we're all of a sudden dropping reporting on cases, even if we think the most important indicator is now hospitalizations or something like that, because of the general community interest in knowing what the case counts are. So that'd probably be something that would go later compared to other interventions, like the way that we deal with cases and how we, deal with outbreaks. That would come first.
Great. Thank you so much for that. Anybody else? Okay. Well, with that, Dr. Renaday, we'll bid you adieu, but thank you again for your time, and we will see you in a few weeks.
Okay, thanks.
Okay, everybody, we're going to move on to item 4, long-term care division. We have 3 information reports here. I'll look for a motion to accept all 3, please. Councillor Boucher and Councillor Ferguson. Any discussion? I'm seeing none. Then I will call the question. All in favor? And those are passed. We have 1 report requiring a motion. That's a 10-year capital asset management plan and forecast report. We'll look for a motion on that. Councillor Arnold, Warden Marriott, you're moving the recommendation. Okay, thank you. Any discussion or any questions? Councillor Cook and Councillor Ferguson, in that order, please.
Okay, thank you. So just looking at the funding report for the capital, I guess it does really make us seem like we're putting a lot of pressure on our capital reserves going forward. You have to be looking more towards internal work that we need to do for our own capital assets, as opposed to looking outside to, I would say, help the community, but taking on outside sources of funding. The report shows the last 5 years really ramping up, and I'm trying to figure out how the numbers work for that, because especially with Lantern Meadowview, we're putting in $1 million, maybe $1.1 million for the first 5 years, and then the last 5 we're putting in 50. I'm just trying to figure out how those numbers working in our system.
All right, who'd like to stick handle that? Ms. Joris?
Sure, I'll try. Through you, Chair White, to Councillor Cook. We're hoping that, so the finances that we would need for a new Lambton Meadowview Villa will be for a down payment. And then the funding that will come from the ministry, hopefully, this is what's happened before, would help us to pay the mortgage. So our some of the funding would come from debt, some would come from levy, and we would hopefully have a little bit of money each year to put away for those big purchases that we need to do. As far as the specific amounts going in, perhaps Mr. Polarchio could provide a little bit more depth on that than I can. I'm not sure if I've fully answered your question.
Through the chair, I just to echo what Ms. Joris was talking about on the funding part of it. What we attempted to do is basically do a 10-year capital plan, and the last 5 years is basically putting into place a placeholder of what may happen at Lambton Meadowview Villa as far as either being a major repair or total renewal. In order to do that, we put $50 million in, and we're looking at potentially financing that through, as Ms. Shore said, through money that we've put aside in the reserve fund, some potential debt, and hopefully some provincial and federal funding that could be attached to it. But the purpose is try to get us accustomed to more of a long-term financial planning process for all our important assets, which long-term care is definitely a key component within the county.
Councillor Cook?
Yes, just to follow up. So then, is there a reserve fund set up for the homes right now, or is this going to be brand new that we're setting up?
Oh, go ahead, Larry.
Yeah, so a part of this report is basically setting up the establishment of a new long-term care reserve fund in order to ensure that there is funding in place and it's tied and integrated to the asset. So that's what the recommendations are stating.
Thank you.
Okay, thank you. Councillor Ferguson?
Just a quick question. As I look through, the cost stays fairly stable from year 1 to 5, but are you really allowing for inflation or capital cost increases? Should there be more in year 4 or 5? Just a question. Thank you.
I think we're guesstimating as closely as we can. There are a number of significant projects that need to be done shortly, according to the building condition assessments, that should reduce a little bit after the 3 and 4 year mark.
Thank you.
Okay, thank you. Yes, Councillor Stark.
Yes, this would be directed to Mr. Polarchio. And this goes back to a point that Councillor Cook raised, I believe it was last meeting or the meeting before. And that was the concept of pre-borrowing in these low interest rate environments. And I referred to a CTV program where I saw the governor of the Bank of Canada interviewed, and his comment was with respect to inflation. And the inflationary expectations from his point of view were in the balance of 2021, it would be 4.5%, and through 2022 would be 5%. And given the fact that the Bank of Canada has stopped purchasing bonds, that really leaves only one avenue for fighting inflation, and that is increasing interest rates. So again, going back to Councillor Cook's comments of last month, I believe, I think there's merit in at least investigating this concept of early borrowing. And I'll give you the example. And I'll use the $50 million that we're talking about with respect to long-term homes. If we were to borrow $50 million, and if we were paying a current interest rate of 2%, 2.5% in terms of borrowing costs, And in fact, if inflation were to increase, driving up interest rates, we would have locked in those funds at 2.5% as an example, and potentially could invest that money over the 5-year period that we're talking about at a higher interest rate, essentially meaning that we were borrowing the money at 0% with the offsetting investment component. Why that's important is if we were to borrow it on a longer term basis, that means that as we approach the use of those monies, we would in fact have the opportunity of utilizing capital monies at 0% interest. Now, the caveat to that is, do we have the borrowing capacity? I believe we do. But as many have indicated, we have we have pressures on us for other expenditures in the short term. So the salient point is there an opportunity to lock in money and offset those monies with investment income, which is expected to rise based upon the Bank of Canada's at least 2-year expectation? Your comment, please.
Again, through the chair, a very good question through Councillor Stark. I want to reassure the council that we're looking at our debt policy and basically the pros and cons as to basically pre-borrowing. On its surface, pre-borrowing for an asset that is yet to be developed or bought is looked at from negatively because you don't own the asset, you don't have the asset, you're paying interest. But in certain situations where you're expecting interest rates to potentially increase significantly, it may be something that would be considered. It's always considered in low rate interest environments that you try to capitalize on your capital asset management planning. We're in the low interest rate period. We do know that. And with the expectation that potential interest rates could increase, there is a savings if you issue debt sooner rather than later. But you have to quantify that savings as well, because the term of the debt could offset any interest rate fluctuation in savings. So it's something that we're looking at from a financial analytical point of view, and on a go-forward basis, we hope to provide you with the debt management policy that reassures you that as a team we do look at all situations and scenarios.
And just as a follow-up, I wondered if we could get a report back on that in terms of how that would interplay with what we're doing currently. I don't know if you need a motion to that effect, but I certainly would like to hear how you're utilizing this potential strategy as it relates to all of the other things that you're doing.
The intention, I don't know if this helps, but the intention is to provide a debt management policy within the first quarter of 2022 back to County Council to review and approve.
And it would include this scenario, this potential scenario?
We would definitely try to include an example pertaining to this scenario. But there's other scenarios that this could pertain to as well. It's basically the pre-borrowing of funds in order to acquire and own an asset.
Indeed, this is going to come up later in the meeting for other issues, so I would appreciate that. Thank you very much.
Okay, thank you. Is there anything further on this motion? All right, I'll call the question. All in favor? And myself included, that is passed. Thank you so much. Is there any other business from the committee in regards to long-term care? I see none. Ms. Joris, how about for yourself?
Not for me this morning, thank you.
Okay, thank you so much. Thank you for the reports. We'll move on to corporate services. We have 2 information reports, 2022 committee membership rotation, and a return to in-person meeting supplemental report. Looking for a motion to receive both of these, please. Councillor Cook, Councillor Stark seconds that. Any discussion? Councillor Arnold.
Thank you, Mr. Chair. I thought on the supplemental report they were asking us for a decision in there. There's no recommendation, but I think there was a decision asked for sometime in regards to January return, April return, or any return.
You're correct in that assumption. I think that I would be moving for looking at their thing. They're looking for March, I guess, would be the one that would get us past the date of having to install the glass partitions at this point. I would move that we would look at March as a return date.
Okay, so let's pull back just briefly here. We'll separate the two reports. We have a motion moved and seconded for the first information report. So let's just call the question on that. If there are no further questions, I'll ask if there are any further questions on the committee membership rotations. I see none. All in favor? That is passed. Okay, thank you for that. So item B, return to in-person meetings. Councillor Cook, you are moving March? Yes,
I would move March as a return date just to see what the province is at that point.
Okay. Councillor Stark seconding that. Any discussion? Mr. Tifo?
Yep, just quickly, in terms of the return to council in person date, the current plan of the province under its reopening plan that was communicated back on October 25th is to have the masking requirements lifted by March 28th. So if we wanted to avoid that date, I think it would probably be best to move it from March to April. So effectively you'd stay electronically for 2 additional meetings, meeting February, March, and then return in person in April, subject, of course, to any sort of changes in the reopening plan.
Councillor Cook, is that
I'm
satisfactory?
Yeah, I'm good with that. That's good. Okay.
And Councillor Stark, you as well? Okay, thank you. Councillor Bouchy, you had your hand up? No? Okay. Anything further on this item? Seeing none, we'll call the question. All in favor? That is passed. All right, we have an information technology staffing levels report requiring a motion. Councillor Stark, you're moving.
I just wanted to follow up with Mr. Tifo. The previous motion, is that consistent with the AM committee's position, or did they have a position?
No, this report wasn't presented to committee AM this morning. It's solely before you.
Okay, thank you.
Okay. So I'm looking for a motion on the IT staffing levels. There's a recommendation in there. If anyone cares to move that. Councillor Ferguson, do we have a seconder? Warden Marriott. All right, and again, the recommendation is that County Council instruct the corporate manager, information technology, to incorporate an additional full-time network engineer. So just so that we're clear. Councillor Cook?
So I guess we'd be looking at this long-term, not as a short-term relief. This is going to be an ongoing position that would be filled in perpetuity.
Mr. Tifo?
Yes. Oh, sorry.
Sorry, Mr. Wilkes, I didn't see you there. Yes. The answer is yes.
Sorry, yes, the answer is yes.
Okay, great. Thank you so much. Any other questions? Councillor Ferguson.
When moving more to the IT, does it reduce staff on the paper side? I just kind of followed up on Mr. Cook's there a little bit.
I'm sorry. Can you ask that question again?
So we're adding the IT people, which we do need. Does it reduce the need for copying paper, et cetera, other staff on the hard copy side that would be reduced in the long term?
Not directly from this position per se. The various departments and divisions are always looking at implementing new technology to do more with less. So to reduce paper, to increase services or move things online, or to provide more services with the same or less people. So although not directly with this position, that's something that is looked at on most software and most departments and divisions as we're implementing new technology.
Good,
Doing
thank
more
you.
with less.
Great, thank you. Any other questions on that? Seeing none, call the question. All in favor? And opposed? All right, that is passed. Thank you. Is there any other business for corporate services from the committee? I see none. From staff, Mr. Tifo?
Nope, none that I can think of at this point in time. Thank you.
All right, thank you. Moving on to finance, facilities, and court services. We have one information report, court services third quarter 2021 stats and activity report. Looking for a motion to receive that. Councillor Broad, Councillor Cook, thank you. Any questions? None? All right, call the question. All in favor? And that is passed. Thank you so much. One report requiring a motion, a 2021 third quarter monitoring report. There's a recommendation there. Councillor Arnold, thank you. Do I have a seconder? Councillor Ferguson, thank you so much. Any discussion, questions? I see none. Call the question. All in favor? And that is passed. Is there any other business for finance, facilities, and court services from the committee? I see none. From staff, Mr. Pellecchio?
No, all good. Just FYI that we're all working towards our asset management plan in preparation for the 2020 budget.
Great. Thank you so much for that. Thank you for the reports. And we'll move on to social services. We have 5 information reports. Ontario Works Service Plan 2021-2022 report, a 2021 homelessness enumeration report, a discrimination survey research analysis report, a licensed childcare fee relief report, and the housing services statistical report for quarter 3. Look for a motion to accept all 5 or any one in particular that you wish to discuss. We'll look to Councillor Broad, all 5. So you're muted, sir.
If we could pull out 7D, that would be appreciated.
Okay. All right. And Councillor Stark, are you looking to pull?
7C, please.
Okay. All right. So let's just do report A and B, if anyone would care to make a motion on that to receive those. Councillor Broad, Councillor Cook seconds that. Any discussion? All in favor? That is passed. All right. Item C, let's bring that up for discussion. I'll throw to you first, Councillor Stark.
Yes, thank you, Chair. I guess what I'm looking for here is the authority on our committee's part to ask for a distribution of this information, the discrimination survey, to go back to lower tier municipalities, to make them aware, to make all citizens aware at all of the levels that the discrimination survey, as identified in C, where 363 people were surveyed, that this is in fact a significant problem that people may not be aware of. And in fact, 66% of those 363 people that were surveyed have indicated that discrimination in one or more contexts in the past 3 years has been experienced. One, by 81%, of Indigenous respondents and by 71% of Black respondents. What that tells me is that there is a problem. This is not a time to be burying our heads in the sand as if it weren't a problem. And we need to bring this awareness to people at all levels of our county that we need to address this. And I would like to get Ms. Colasante's comments on that, if in fact I get a seconder to distribute this to all of the lower tier municipalities.
Okay, so pretty straightforward. A motion to submit this report for distribution to all municipalities in the county. Is there a seconder for that? Councillor Ferguson, thank you. Is there, Ms. Colasanti, you were asked by Councillor Stark if you have any comments.
For you, Chairperson White, to Councillor Stark, I would agree with your comments. We did have quite a large number of individuals complete the survey. We have had a conversation with it at the Local Immigration Partnership Board, and certainly we would be happy to get this information out and share it with our lower tiers. We're going to work with the Local Immigration Partnership Board to have conversations about what we can do to start to change this. And I know a lot of work has already been done. There are many subcommittees, so we will continue along that because clearly there is still some work to be done.
I would say absolutely. Councillor Stark, follow up.
I just want to first comment or congratulate Ms. Colasante and her group for being a proactive force with respect to this issue. I know this is an uncomfortable issue for people to talk about and one to recognize, but the fact that we are moving forward is a compliment to you and your organization and to your staff, and I want to tell you that I fully support you in your efforts, and thank you for it, quite frankly.
Thank you, and I'll certainly pass that on to the board. Thank you.
Councillor Cook?
Yeah, thank you, Chair. Just through to Ms. Colasanti. So just being COVID related in the last year, it's great to see that you got that many people responding. But on the same token, with COVID, do you know if any of this could have been exacerbated by the fact that a lot of people were being forced to stay in their homes, or when they did go out, they're maybe getting a little more resistance than what they could have gotten in the past?
Through you, Chairperson White, to Councillor Cook, it's really hard to answer that question. We had a third-party group do this survey through Western University, so it is really hard for us to know that, and we would really just be making an assumption. So I'm not sure what the answer to that is, unfortunately.
No, that's fine. Appreciate that. Okay.
Are there any other questions? I mean, I have one, and this would either apply to county council or to the lower tier municipalities. But I think this information is so critical that just having it presented to council in a report maybe doesn't have enough of a broad stroke in terms of getting the message out there. And I'm wondering if it's possible to have an actual presentation of some kind. Again, whether that be just made available by request from the lower tier municipalities, or if perhaps we could start even with county council. I'm not making a motion at this point. I'm just asking the question, is this information quickly and easily translatable into something that would be a presentation for council?
Thank you for that question. I think we could do a presentation on it. We would certainly want to reach out to the university and see if we could have the individuals who worked on it make that presentation. I'm not sure they would be able to dwell any more into the data because they were looking to compare it also to other communities. But certainly we could ask, and our own staff could make a very brief presentation on on this data to the lower tiers if that was a request, certainly.
Okay, thank you for that. So we have a motion from Councillor Stark in regards to distributing this report to lower tier municipalities. Are there any other questions or comments? I see none. I'll call the question. All in favor? And myself included, that is passed. Thank you for that. We are going to item D now. I believe Councillor Broad, it was yourself that brought this forward?
Yes, thanks, Chair White. Yeah, I just want to, before we start to discuss this report, I want to thank Ms. Colasanti and her group that's been working on this for me. They've put a lot of hard work into it, and I know they're still trying to gather some answers on it. But I just want to make this committee aware that not all residents of Lambton County apply or qualify for this grant. It's very unfortunate that you could live in the county of Lambton, but your licensed daycare is outside the county of Lambton and you don't qualify for this program. I had a couple calls from individuals in my township that was very concerned and upset about it when they were told they didn't qualify. So I just want this committee to know that's going on. My other concern with it is they're going to be dependent on the licensed child care facilities to present information to the county so they can, the county can forward the proceeds to those individual licensed daycare centers. I just want to make sure that our neighboring municipalities' residents don't receive the funding when our own residents don't qualify for it. So I know Ms. Colasanti's working on that for us, but in case you guys get some calls, I know I'm sure Chair or Councillor Arnold and Councillor Ferguson being on the fringes and Councillor Cook, they could be getting some calls that people are pretty upset that they don't qualify. Ms. Colasanti's reasoning makes sense when she gathered that up. So just want to make this committee very aware of that. So.
Okay, thank you for that. Ms. Colasanti, would you be able to just fill in the gaps for those of us who haven't experienced this yet?
Certainly, through you, Chairperson White. Actually, I'm going to call upon Melissa Fitzpatrick. Melissa is the manager of our child care services to speak to this issue.
Thank you.
Thank you, Valerie, and through you, Chair White. So just a little background of this one-time fee relief. We are using, as the report indicated, funding from the Ministry of Education as our base allocation. It will be issued as a grant to our licensed child care providers in Lambton County under our existing purchase of service agreements. So outside of the County of Lambton, we don't have agreements with other municipalities as they'd be covered with their home municipality. So that's where the limitation comes in with us only being able to assist licensed child cares in the County of Lambton.
Thanks, Melissa. And if I could just add to that, we don't have a legal agreement with any families. We only have legal agreements with, again, the operators. So our funds go to the operators. But we have asked the operators when they report back to us to just list those families that reside within the County of Lambton.
Okay, thank you for that information. Councillor Broad, thank you for raising that for the committee's information. It's appreciated.
And again, I want to thank Ms. Colasanti and her staff because they worked hard on this the last few days trying to get some answers, and they did a great job as usual, so thank you.
Great, thank you for that. Are there any other comments in regards to item D? Okay, I see none. I will just ask if there's anything specifically for item E, the Housing Services Stats Report. I see none, so I will look for a motion to receive D and E together then, please. Councillor Broad, seconded by Warden Marriott, and last call for discussion. I see none. Call the question. All in favor? And that is passed. Thank you so much. We have one report requiring a motion. The Affordable Housing Capital Plan. There's a recommendation there. Councillor Stark, Councillor Cook, any discussion? Councillor Stark.
Yes, thank you. And this, I believe, Ms. Colasante will be able to comment on this. For those who attended the report, I guess, or attended the report last week on affordable housing, we talked, or a discussion ensued regarding establishing a reserve, which I am fully in support of, and obviously support this motion. The discussion that ensued, and unfortunately I had to leave the meeting early, but it spoke to Chatham-Kent's model of establishing a reserve, in their case, of $1 million a year, plus inflation on an annual basis. And I was able to glean that information from Chatham-Kent and their housing authority manager, who in fact shared very detailed information, and I'm thankful for it, which of course I shared with Ms. Colasante and Mr. Van Horn. Whether this particular motion relates to that discussion or not is the topic of my question. And that is, when I read the report, it looked as if we were transferring money from a former grant in order to ensure that we didn't lose in other words, run out of time as it related to that grant. So we moved it from repairs to a reserve and committed to do the repairs. At any rate, it amounted to about a little more than $1 million. My question then is, this reserve, and I recognize that you're looking to do a study, but my question is, does this reserve anticipate being funded through levy, or is it simply looking for grant money from the province, or a combination of the two, whereby we would be matching the province, or how do you envision that working?
Through you, Chair White, to Councillor Stark. Thank you for that question. The reserve that we're looking at, you're correct. We have some dollars now that we've put aside. We received some provincial dollars for repairs, and we weren't able to utilize them. So we've moved them into a reserve. So we have some dollars to start it, but this particular request would be for levy dollars. We're looking for levy dollars, believe in the tune of about 3.8 million a year over the next 10 years to equal the 38 million that we'll need, that we assume that we will need based on the study that we've been doing. So we would match that then with provincial and federal dollars, but that would be the portion that we would need to be able to apply for other grants that come up. Oftentimes we find the province or the federal government will announce funds and we don't have matching funds available. We don't often have shovel-ready projects. This would allow us to start to get ahead of that so that when those funds are announced, we can quickly come forward with a project and some dollars.
Councillor Stark.
Thank you. I assume that to be the answer, and I appreciate the answer. This is where I want to go back to my previous comments with respect to Councillor Cook's thought process from a month ago, and this goes back to Mr. Pilarchio's answer. This, to me, is an example where you need to have money in hand to be able to match funds in order that you don't miss an opportunity such as you're identifying. So the comment that I made with respect to would have applications to other items later in the meeting. This is the other items. So is it, are you working hand in glove with Mr. Pilarchio's department as it relates to obviously one, budgeting, but two, looking for alternative sources of funding to accommodate this matching fund requirement? That really concerns me. Is we potentially could be offered a grant, but we couldn't be able to match it because we don't have monies available.
Through you, Councillor Wright, to Councillor Stark. Yes, we are absolutely working with finance on this, and we've advised finance of what our requirements are, and then they will tell us how that will work and how to finance them. I believe Larry Clarkio is still on. Larry, could you add to that in any way?
Yeah, you're still on mute, sir.
Through the chair, I just want to thank you for the question. I just want to assure everyone that finance is working, hand in hand with Ms. Colasanti's service area, social services, and seeing how this, master plan will be funded. She is very correct in that the contributions to this reserve would be levy finance, and there are we're looking at the funding model on the best way we can access funding as quick as we can. But we are very much working together on this.
Councillor Stark?
Thank you very much. Mr. Pilarchio, this goes to the very issue of trying to qualify. If we require qualification for an advanced loan, as I'm suggesting, this would be an example of how we would qualify. This would be a tangible qualifying factor as it relates to applying for a loan, an advanced loan, again at current interest rates, then taking those reserves and investing them as interest rates rise to our advantage. So I raised that as an example, a tangible example of what I'm talking about. Thank you.
Thank you, sir. Any other? Yes, Councillor Cook.
Yeah, and so I guess it just goes back to the same comment I made before, that this is really starting to put a lot of pressure on our budgeting, and I mean that in a good way, because these are things that we need to look after at the county level. But when it comes to outside requests, I think this is where we're really going to have to think long and hard about where the dollars are going to have to be invested, or where they're going to have to be spent, because these are needs that we have to deal with first before the outside interests are coming to us for grant requests. That's just my comment.
Thank you. Any other thoughts, comments, questions on this particular motion? I see none. I'm fully in support myself, looking forward to it, and agree with Councillor Cook's comments 100%. Our core mandate is of utmost importance, and it's going to cost a lot of money as we move forward. So thank you for this recommendation. I think that's it. So we'll call the question. All in favor? And myself included, and that is passed. Thank you. Do we have any other business? I'll go to Councillor Loosely first, and then Councillor Arnold.
Thank you, Chairman White. It's not related to the social services at all. It's just other business for the committee. Would you like me to raise it now or wait till later on?
I'll just, if you could just hold on to it for one moment, please. I will go to Councillor Arnold to see if other business is for social service.
Well, thank you, Chairman White. It overlaps into social service, and my comments are just comments, and they go to our CAO, Mr. Van Horn. And I know Mr. Van Horn reviews all of our reports that we get and his department. And I guess for me, and some people here may think it's pretty trivial, but I brought it up a number of times before over the years. But throughout some of these reports, all of us, I think it's for all of us, are referred to as Sarnia-Lambton. I don't think that it's right to have us as Sarnia-Lambton, in especially county orchestrated reports. And I understand outside agencies like the local immigration folks and people like that are not part of the county per se, through this committee or through this council. But anything that's generated inside of Lambton County should refer to us as Lambton County and not Sarnia-Lambton. And I guess my sensitivity was heightened today when I got a note saying about the Sarnia-Lambton community, which I, for one, am not part of, and my municipality is not. I'm part of Lambton County or St. Clair Township, and I believe that here in this chamber, we should be being referred to as Lambton County, and the Sarnia-Lambton is not applicable. That's just my comment, and that goes back to Mr. Van Horn. Thank you very much.
Thank you, sir. Thank you for raising that. Point well made, and I agree with you for what it's worth. And I see another thumbs up from Councillor Ferguson. So thank you. So we will close off the social services portion. So thank you for the reports and recommendations today. And now Councillor Loosely, you'd like to raise a matter?
Yeah, thank you, Chairman White. And again, this is a comment that I wanted to bring forward to this committee. I just wanted to state my disappointment in not including the recorded vote in our minutes from our last meeting. My understanding is that a recorded vote is to be a record. If a recorded vote is not allowed in our committee meetings, please show me where it states that. And I realize that the county has already approved these minutes, but would like to correct it, if possible, the next time. And I've also stated my dissatisfaction to the clerk as well. Thank you.
And thank you, Mr. Loosely. I'll allow Mr. Tifo to respond to that. But Mr. Loosely, would you mind just clarifying which motion or motions specifically you were referring to?
I think we only had one recorded motion at our last meeting. I think it was to do with the amendment to the capital projects. But I don't think that's the concern. I don't care what it was. I'm just concerned of when this committee requests a recorded vote, that it should be in our record. That's just my feeling. I feel quite strongly about that because that's the idea of a recorded vote. Thank you.
Okay. Thank you. Mr. Tifo?
Yes, thank you very much. And of course, through you, Chair White, and to Councillor Loosely, we did have that discussion, and I appreciate the issue being brought to my attention. And the issue goes back to your committee's last meeting last month with respect to the exception for Blue Water Health being accepted from the freeze on capital grants from the county. And there was a vote being taken, and at that point in time, because of some confusion and votes going in favor and votes not going in favor, Chair White, you did ask for assistance, and you did utter the words asking for a recorded vote. And at that point in time, I should have mentioned to the committee then that the committee structure is an informal structure. There's no recording of votes per se like we do at council, because again, the committee structure is meant to be sort of the groundworks for official decision making at council itself. So I should have noted that there is no recorded vote per se at the committee structure. But I didn't. All I said was at the time was that given that it's committee, I'm just going to process with whomever and go on with the vote from there, and essentially take the tally. But the policy behind all of this is that throughout the ages, in terms of practice at the committee level, at an informal level, there's no way to vote at the committee structure. And secondly, with respect to recorded vote, there has not been a recorded vote practice or requirement in the committee structure for those reasons that, again, the committee is meant to be an informal sort of advisory service body to council.
Okay, well, thank you for that explanation and clarification. And if I think back several years, probably my first year on committees, I believe there were a couple of recorded votes asked for at the time too. But again, probably for my own learning, I'll reflect back and see that was more of an informal request as well. I believe that would have been under yourself, Councillor Arnold, as chair in my first year. But memories fade, and I will accept this as well as a learning opportunity for myself as chair. So thank you for that, Mr. Tifo, and for raising the issue, Councillor Loosely. looking for a recommendation now. If there's nothing else in general, we'll go to item 8, and I'll look for a motion to ask myself to declare that we go in camera to discuss the following: to receive information pertaining to the security of the property of the municipality or local board pursuant to section 239 2A of the Municipal Act 2001 arising from a cyber incident previously reported to council. If Councillor Broad moves that, Councillor Cook seconds that. All in favor? And we will now proceed to move in camera. So with that, we will just delay momentarily while the live stream. All right, thank you. Thank you, everybody. And that brings us to the end of the agenda. We will report out on the closed at County Council. Councillor Arnold, was there a comment, question, concern?
Yeah, thank you very much, Chair White. Just a comment that when we go into camera, we need to make sure that people understand who's invited and who's not. I just went in to check the participants. We had 19 participants on our in-camera session. Now we're up to 21. So I think there's a security piece there that we need to ensure, or I would suggest that you ensure before we actually do go in and discuss in-camera items.
Okay, thank you. We did hear from staff that they were moving the unnecessary, I suppose, folks to another room during that meeting. So I did hear that from staff, but we can certainly ask a follow-up question as to the validity and assurance that only the folks that are in the room are the ones that should be there. So thank you for raising that. Anything else from the committee? All right, I'll look for a motion to adjourn. And that is Councillor Loosely, Warden Marriott seconds that. All in favor? Thank you, everybody. Have a great rest of the day. We'll see you at the next County Council meeting.